Mathematics time. According to the online Punch newspaper, about 1,800,000 candidates registered for the 2022 UTME. Okay, now out of this 1.8 million who sat for the examination, about 367,499 chose medicine and surgery as their choice of course. That is a ratio of 5:1, meaning that for every 5 JAMB candidates who register for the 2022 UTME, at least one of the 5 JAMB candidates chose medicine and surgery as his or her course. Now one thing that is now paining me. Punch newspaper also went on to say that the total number of slots for medical students in Nigerian institutions is about 43,707. If you also do that ratio, that is a ratio of 1:7, meaning that for every 1 JAMB candidate that gets medicine and surgery, about 7 others or 6 others are left to go home or given another course entirely. And there are some candidates that actually want this medicine like mad. It is medicine or nothing. So if they are not giving medicine at all, they will not prepare for the following year and will take UTME. And it is not as if when they are taking UTME the following year, the competition reduces. No, it gets tougher and tougher each day. And that is the main purpose for making this video. I want to highlight 5 other courses that are related to medicine and surgery. So instead of always applying every year, taking medicine and not getting it, why not consider applying for these other 5 courses that are also closely associated to medicine? But before then, let me now welcome you at this point to this channel. If this is your first time, I am Everest Ajis and the CEO of Everest Tutors Academy. If you have not joined this community, kindly do so by hitting the subscribe button and turn on notifications so that whenever I upload my new video, you would be the first to be notified. Alright, let's go back to what we were discussing. What are those 5 other medical courses that you can actually opt for? The number 5th course is actually anatomy. When some people hear the word anatomy like this, they start taking to their heels, running away. Come on, I cannot come and become a mortuary attendant. So no. Anatomists are not just mortuary attendants. There are many other career opportunities in anatomy. An anatomist is a specialist that studies the internal structures of humans or of living organisms in general. They know the different parts of your body, your bones, your joints, your ligaments, and how they are all coordinated to bring about movement and other functions of humans. Normally, anatomy is a 4-year course, but if you are studying it in Nigeria, just prepare for 5-6 years. You know the reason now, ASU strike and the other, you get the point, fine. So anatomy is a 5-year course, and also after the 4-year, 5-year program, you will be given a certificate, BSc. Then you can then decide to further your study by going for your master's or your PhD. What then are the career opportunities in anatomy? Number 1 is actually in the educational sector. You can become a lecturer and also teach other anatomy students. Number 2 is in the health sector. You can actually work in the health niche, but I need to be sincere with you. Working in the health niche is not actually very much common in Nigeria. You know the reason? The reason is that Nigeria has not yet reviewed and accepted the Anatomy Act. The Anatomy Act gives license to anatomists to practice in the medical field in areas that relate to their field of study. So it is possible in Nigeria, but it is just very rare. However, if you have the opportunity to jackpot to another country, or more, it's very superb there. Anatomy, you can practice, work hand in hand with doctors in areas relating to your field alone. You can also become a chiropractor, always helping people set their bones. Since you understand how the bones work, you should be able to do that. Not only that, you can also be a massage therapist. When people need to get massaged, they just come to an anatomist to massage. They're not normal massage where you know that you just be pressing someone's body. No. There are professional massages and they know how to do that very well. Anatomy, they are trained to do that. The first course I now want to tell you is actually physiotherapy. Although a physiotherapist is not a medical doctor, although a physiotherapist is not licensed to give drugs on his own, however, they work hand in hand with medical doctors in the hospital. A physiotherapist is an expert that is trained to treat patients using what we call physical techniques or modalities. An example of a modality is actually massaging. Another example of a modality used by this physiotherapist is what we call exercises. If you have a physical deformity or an injury, They know the right types of exercises that you can do that will help that part of your body get healed. You have a back pain, you have problems relating to your bone, physiotherapists are the best options here. And there are many career opportunities in physiotherapy. As I also explained earlier, they work hand in hand with doctors. Apart from that, they can also work in fitness centers, that is gym, where people are always coming to exercise, and some other parts of the medical field. Now, the third course I want to go for is optometry. Well, let me explain. We have optician, we have optometrist, and we have ophthalmologist. If you are short-sighted or you are long-sighted, whereby you just need lenses, refraction of the eye alone, then you might want to see an optician. Now, if you now have a problem of the eye, whereby drugs will be recommended, eye drops or any other problem of the eye, you might want to see an optometrist. An optometrist knows everything an optician knows and is also licensed to treat patients by giving them drugs. However, if your eye condition is very critical, like like surgery is needed, you might want to see who? An ophthalmologist. But before you become an ophthalmologist, you must have studied medicine and surgery for 6-7 years. After that, you will now go and specialize in what? In ophthalmology. But there are some institutions that actually offer optometry as a course of study. I think it is for 4 or 5 years. So after that period of study, you just go, you establish your own clinic, eye clinic, or you can choose to work in a private sector or even a government hospital. You are licensed to do that. Alright, let's go to the next one. What is the next course of study this time around? The second course I want to give to you is nursing. Nurses work hand in hand with doctors in the hospital. And when I say nursing, I do not only mean female nurses. In fact, males also study nursing. You can choose to study nursing in a university, or you choose to study it in one of the schools of nursing that we have in Nigeria. The first course I want to give to you is actually dentistry. Dentistry is very related to medicine. In fact, in some institutions, there are no clear differences between those studying dentistry and those studying medicine. They receive the same lecture in the same lecture room. However, at a point in their course of study, they all have to divert into their different specialties. So in conclusion, medicine is actually very nice. But instead of always chasing it for 2, 3, 4, 5 years and still not get it, why not just decide to opt for another lower course, like less competitive course, but still related to that medicine? In fact, after graduating, you can still decide to pursue your academic medical course. For instance, I have a particular guy that is a graduate of anatomy in Unilag, but he is now a second-year medical student of UNN. So you can still go back to your medicine that you still want. So I hope you found this video very interesting and educative. If so, kindly hit the subscribe button and turn on notification. Thank you for watching. We will see you in the next video next Sunday evening as usual.